Your kidneys are filtering your blood right now, removing waste that your body doesn't need. But what if they're struggling? What if they're sending you signals and you have no idea what they mean? Your kidneys don't hurt until it's almost too late. Most people think kidney disease only happens to people with diabetes or high blood pressure. But here's what doctors see. Kidney problems develop silently in millions of people who have no idea their kidneys are failing. The shocking part? Early warning signs are usually visible. You just need to know what to look for. Think about your last few weeks. Have you been more tired than usual? Did you notice your ankles are puffier? Have you been getting up more often at night to use the bathroom? You probably explained it away. Getting older. Normal. No big deal. But your kidneys might have been sending you a message the whole time. Hello, I'm Dr. Claire Carter. I've spent the last 10 years watching people get devastating news about their kidneys. People who had no idea anything was wrong until their kidney function had already declined significantly. The good news? Your kidneys are trying to tell you something. They send signals, clear signals. And if you know what those signals are, you can catch kidney problems early, when they're still treatable. Over the next few minutes, I'm going to walk you through 5 warning signs that your kidneys are struggling. I'm going to explain what each one means, why it matters, and when you should absolutely talk to your doctor. This is practical information that could change your health trajectory. Not based on fear, based on facts. By the time this video ends, you're going to know exactly what your body is trying to tell you about your kidney health. You're going to understand which signs can't be ignored. You're going to feel empowered to take action, not panicked, but informed and capable. And you're going to have a clear reason to get your kidneys checked if you've noticed any of these signs. What your kidneys do and why they matter. Let me start with basics. Your kidneys are 2 bean-shaped organs, about the size of your fist, that sit on both sides of your spine below your rib cage. Every single day, they filter about 120 to 150 quarts of blood to produce roughly 1 to 2 quarts of urine, waste and extra water your body doesn't need. But that's just the waste removal part. Your kidneys do much more. They regulate your blood pressure. They control how much water your body retains. They produce hormones that help make red blood cells. They keep your bones healthy. They regulate the balance of minerals and electrolytes your heart needs to beat properly. Your kidneys are essentially the control center for your body's balance and chemistry. Now here's what's important. Your kidneys have incredible reserve capacity. You can lose a significant amount of kidney function and still feel fine. You can have one kidney that doesn't work and the other can compensate. This is actually a problem because it means kidney disease progresses silently. By the time you feel sick, you might have already lost significant kidney function. Most people have no idea their kidneys are struggling until they get routine blood work and their doctor says, "Your kidney function is declining." It comes out of nowhere, but it shouldn't. Your kidneys send signals. Your body is trying to tell you something is wrong. Here's what's important. Kidney disease caught early is very manageable. You can slow its progression. You can prevent it from getting worse. You can protect your remaining kidney function. But you have to catch it early. And early detection starts with knowing the warning signs. Warning sign number 1. Changes in urination patterns. The first warning sign is changes in how often you urinate or what your urine looks like. Let me be specific. You're going to the bathroom much more frequently than you used to. You're getting up multiple times at night to urinate. This is called nocturia. You used to sleep through the night, but now you're up 3, 4, 5 times. That's a signal. But there's more. Look at your urine. Is it foamy? Does it have a lot of bubbles that don't go away? Foamy urine can indicate protein in your urine, which is a sign your kidneys are filtering things they shouldn't be filtering. Protein should stay in your blood. If it's in your urine, something is wrong. Changes in color matter too. Is your urine darker than usual? Concentrated? Or is it pale and you're urinating a lot? These changes can indicate kidney stress. Also notice, are you urinating less overall? Some people with kidney problems actually urinate less because their kidneys aren't filtering as well. This is particularly concerning because it means waste is staying in your body instead of being eliminated. The timeline matters. If you've noticed changes in your urination pattern that have been going on for more than a week or 2, that's worth mentioning to your doctor. Your urination is one of the clearest ways your body tells you what's happening with your kidney function. Have you noticed any changes in how often you urinate or what your urine looks like? Is this different from what's normal for you? Just notice. This awareness is the first step. Warning sign number 2, swelling in ankles, feet, or face. The second warning sign is swelling, particularly in your ankles and feet, but also sometimes in your face or hands. Here's what happens. Your kidneys regulate how much water your body retains. When your kidneys aren't working well, they can't get rid of excess water and salt the way they should. This extra fluid builds up in your tissues. It shows up as puffiness or swelling, usually in areas where gravity pulls fluid, your ankles and feet first. You might notice your shoes feel tighter. Your socks leave deeper marks on your legs. Your ankles look puffy in the evening. You press your thumb into your ankle and the indentation takes a while to go away. This is called edema, and it's a classic sign of kidney problems. But it can also show up in your face. You look in the mirror and your face looks rounder or puffier than usual. Your eyes look a bit swollen, particularly in the morning. This kind of facial puffiness, especially combined with other symptoms, can indicate kidney issues. What's important is noticing when this is new for you. Have your ankles always been a little puffy? Or is this a new change? Did you recently change your salt intake? Are you exercising less? There are many reasons for swelling, but when swelling appears without an obvious cause, that's worth getting checked. Swelling combined with any of the other signs we're talking about becomes even more significant. One sign might be nothing. Multiple signs together are a pattern worth investigating. Have you noticed any new puffiness or swelling in your ankles, feet, or face? Something that's new for you or different from what's normal. Has anyone mentioned that you look puffy? These observations matter. Warning sign number 3, fatigue and weakness. The third warning sign is fatigue, not the normal tiredness everyone experiences, but unusual, persistent exhaustion that doesn't match your activity level. Here's what happens. Your kidneys produce a hormone called erythropoietin, which tells your body to make red blood cells. Red blood cells carry oxygen. When your kidneys aren't working well, they produce less of this hormone. Your body can't make enough red blood cells. You develop anemia. Anemia means your tissues aren't getting enough oxygen. You feel exhausted. People with kidney problems often describe it as, "I'm so tired I can barely function. I can do normal things, but I feel like I'm moving through mud. I need naps. Even after sleeping, I wake up tired." This kind of fatigue is different from normal tiredness. It doesn't improve with rest. You can sleep 9 hours and still feel exhausted. It affects your quality of life. You can't do things you used to do. You lose interest in activities you enjoyed. Associated with fatigue is often weakness. You feel weak in your muscles. Climbing stairs is harder. Carrying groceries feels exhausting. You feel physically weak in a way that's unusual for you. What makes this significant is that it's persistent and unexplained. You're not working harder. You're not under more stress than usual. You're sleeping okay, but you're exhausted anyway. That's a signal worth investigating. Fatigue can have many causes: thyroid problems, depression, anemia from other causes, vitamin deficiencies. But when it's combined with other kidney warning signs, it becomes more significant. The good news is that when kidney function improves, fatigue often improves too. When people start treatment for kidney disease, when they get their kidney function stabilized or slow its decline, their energy returns, the exhaustion lifts. Life becomes manageable again. Warning sign number 4, high blood pressure that's hard to control. The fourth warning sign is high blood pressure, particularly blood pressure that's hard to control even with medication. Here's the relationship. Your kidneys regulate blood pressure. They control how much fluid your body retains, which affects blood volume. When your kidneys aren't working well, they can't regulate fluid properly. Fluid builds up, blood volume increases, blood pressure goes up. But there's another mechanism too. Your kidneys produce a hormone called renin, which helps regulate blood pressure. When kidneys are damaged, they can produce too much renin, which causes blood pressure to increase further. So here's what you might notice. Your blood pressure is higher than it used to be. You check it at home and it's consistently elevated. You're on blood pressure medication, but it's not controlling your blood pressure as well as it should. You've had to increase your dose. You're on multiple blood pressure medications, and your pressure is still not at goal. What's significant is high blood pressure that doesn't respond normally to medication, or high blood pressure that's new and suddenly hard to control. If you've had good blood pressure control for years and suddenly you're struggling with it, that's worth investigating with your doctor. Now, high blood pressure can have many causes, but when it's combined with the other signs, changes in urination, swelling, fatigue, it becomes a clearer pattern pointing toward kidney problems. Do you have high blood pressure? Is it well controlled with your current medications, or are you struggling to keep it under control? Has your blood pressure changed recently? These are important questions to discuss with your doctor. Warning sign number 5, shortness of breath or chest discomfort. The 5th warning sign is shortness of breath, particularly shortness of breath that appears suddenly or without a clear cause. Here's why this happens. When your kidneys aren't working well, fluid can build up in your lungs. This is called pulmonary edema. You feel like you can't catch your breath. You're short of breath when doing normal activities. You might wake up at night feeling like you can't breathe. You have to sleep sitting up instead of lying down. Also associated with kidney problems is chest discomfort or chest pain. This can happen because of the fluid buildup, or because kidney disease puts stress on your heart, or because of chemical changes in your blood from kidney dysfunction. You might also notice a persistent cough, not a viral cough that comes and goes, a persistent cough that doesn't improve. This can be related to fluid in your lungs from kidney disease. What's important is noticing when shortness of breath or chest discomfort is new for you, or when it's getting worse. These are symptoms that absolutely deserve medical evaluation. Don't wait. These require urgent investigation. Shortness of breath can have many causes: heart problems, lung problems, asthma, anxiety. But when it's combined with the other kidney warning signs, it points more strongly toward kidney disease. And shortness of breath combined with chest discomfort requires immediate medical attention. The reason I'm telling you these warning signs isn't to scare you. It's because early intervention in kidney disease can slow or even prevent progression to kidney failure. When you catch it early, when you get treatment early, when you manage blood pressure and other risk factors, you can preserve kidney function for decades. You can live a normal, healthy life. But you have to catch it early. The timeline and risk factors. Now let's talk about who's at risk. Kidney disease isn't random. It happens to people with certain risk factors. If you have diabetes, your risk is significantly higher. Diabetes damages the tiny blood vessels in your kidneys. About 1 in 3 people with diabetes will develop kidney disease. If you have diabetes, getting your blood sugar well controlled is one of the most important things you can do to protect your kidneys. If you have high blood pressure, your risk is higher. High blood pressure damages your kidneys over time, which then makes blood pressure harder to control, a vicious cycle. Managing your blood pressure is crucial. If you have a family history of kidney disease, your risk is higher. Kidney disease can run in families. If your parents or siblings have had kidney problems, you should be more vigilant about monitoring your kidney function. If you're over 60, your kidney function naturally declines as you age. This doesn't mean you'll develop kidney disease, but it means your kidneys are more vulnerable. If you regularly take NSAIDs, ibuprofen, naproxen, your kidney function can be affected, particularly if you have any risk factors. If you drink heavily, your kidneys can be damaged over time. The point is, if any of these apply to you and you're noticing any of the warning signs, you absolutely should get your kidneys checked. Don't wait. The good news is that kidney function can be assessed with simple blood tests and urine tests. Your doctor can check your kidney function with a test called the glomerular filtration rate, or GFR. This tells you how well your kidneys are filtering. If kidney problems are caught early, when your GFR is still relatively high, you have much better options for treatment and management. Do any of these risk factors apply to you? Do you have diabetes, high blood pressure, a family history of kidney disease? Have you ever had your kidney function checked? If not, have you noticed any of the warning signs we've discussed? These are important questions to consider. Why early detection matters and what to do. Here's the critical thing. Kidney disease often progresses with no symptoms until it's quite advanced. You can lose significant kidney function and feel completely fine. This is why screening matters. If you have any risk factors or if you've noticed any of these warning signs, you need to talk to your doctor about getting your kidney function checked. This is simple. It requires a blood test and a urine test. Your doctor measures your creatinine level, which indicates how well your kidneys are filtering, calculates your GFR, your kidney function percentage, and checks for protein in your urine. If kidney problems are caught when you still have 50% or more kidney function, there are many things that can slow or stop progression. Controlling your blood pressure is paramount. If you have diabetes, controlling your blood sugar is paramount. Eating a kidney-healthy diet, which typically means reducing sodium, managing protein intake, and limiting certain minerals, can help. Treating any underlying conditions and taking medications as prescribed makes a huge difference. But if you wait until your kidney function has declined to 10 or 20%, your options are much more limited. You're looking at dialysis or transplant. Your life becomes significantly more complicated. This is why early detection is life-changing. Knowing your kidney function status puts you in control. You can make decisions. You can take action. You can protect your health. If you've noticed any of these warning signs, don't minimize them. Don't assume they're normal aging. Call your doctor. Make an appointment. Be honest about the symptoms you've noticed. Ask for kidney function testing. Early intervention can mean the difference between managing kidney disease for decades and facing kidney failure. I want to know, have you noticed any of these warning signs? Have you ever had your kidney function checked? What's holding you back from getting checked if you haven't? Drop it in the comments, because your experience might be exactly what someone else needs to hear to finally take action and protect their kidney health. I need to be very clear. This video is educational information only. It is not medical advice. If you're experiencing any of these warning signs, changes in urination, swelling, unexplained fatigue, shortness of breath, chest discomfort, please contact your doctor. If you have shortness of breath or chest pain, especially if it's severe or getting worse, go to urgent care or the emergency room immediately. Your doctor can do kidney function tests and determine what's actually happening. If you have risk factors for kidney disease, diabetes, high blood pressure, family history, talk to your doctor about screening. Your healthcare provider knows your complete health picture and can give you personalized guidance. This is general educational information, not a substitute for professional medical advice. What kidney-healthy eating actually looks like. Because if you do find out you have kidney disease or you want to protect your kidneys, diet becomes really important. What foods are kidney-friendly? What should you avoid? How do you eat in a way that protects your kidneys while still enjoying your food? That's the conversation I'm excited to have with you next. You know what I want you to remember from today? Your kidneys are trying to communicate with you. They're not mysterious. They send clear signals. Swelling, fatigue, changes in urination, shortness of breath, high blood pressure that's hard to control. These are messages. When you recognize the messages, when you take them seriously, when you get your kidneys checked, you're taking control of your health. Your kidneys have been filtering your blood silently for decades. They deserve your attention. They deserve your care. If you've noticed any of these warning signs, get checked this week. Don't wait. Your future health depends on the attention you give your kidneys today. And I'll see you next time.